Good evening. I am Dr. Subhashis Dey, consultant physician at VIP Apex Medical Center Private Limited. Today, I will be discussing with you about heart failure, how it causes edema, and what are the treatment options. Now, heart is the strongest muscle of our body. It pumps around 200 gallons of fluid throughout the body daily. Now, when the heart muscle fails to pump, we call it as heart failure. Now, heart failure can be of two types. One is a heart failure with reduced ejection fraction, that is, when in echo we get an ejection fraction of less than 50%. Now, this can be in this heart failure, the heart is unable to pump the blood throughout the body, that is, the forward flow is affected. As a result, the different organ is hypoperfused, like the kidneys will get less amount of blood, the brain will get less amount of blood, and at the same time there will be stagnation of blood beyond the blood which is coming to the heart will be stagnated, and this will lead to congestive symptom, like there will be congestion in the lungs leading to pulmonary edema, there will be congestion in the systemic circulation which will lead to edema or swelling of the feet. There is another type of heart failure which is called the heart failure with preserved ejection fraction. That is where the ejection fraction is more than 40%, and here the heart is unable to relax, and the symptoms include those related to the congestion. That is, there will be pulmonary edema, there will be congestive cardiac failure leading to edema. Now, what is edema? Edema is the abnormal collection of body fluid throughout the body. Mainly, it is in heart failure. There is dependent edema, that is, the fluid collects in the lower part of the body, in the feet, in the legs. Also, there can be swelling of the abdomen. There can also be swelling of the eyelids. Now, when this edema occurs, you will feel that you will be feeling heaviness of your feet. There will be excess weight gain, difficulty in wearing of the shoes, and also due to this in heart failure, other symptoms include pulmonary congestion, that is, there will be shortness of breath, difficulty in lying supine. Also, there will be, due to decreased perfusion of the organs, there will be kidney failure. There can be decreased oxygen supply to the brain, leading to tiredness and sometimes syncope. So, these are the common manifestations of heart failure. Well, what are the causes of heart failure? Heart failure can be caused due to various reasons. The most common causes are ischemic heart disease after a myocardial infarction or heart attack, in some valvular heart disease, in hypertension, some genetic disorders, some inheritable familial disease, some viral infections, which we have seen in COVID-19 also, there were some myocarditis. So these are roughly the causes of the heart failure. So whenever you feel shortness of breath while walking or while lying down, or you feel that there is swelling, abnormal swelling of your feet, or abnormal weight gain, decreased appetite, feeling of heaviness of the abdomen, or there is swelling in the abdomen, do not hesitate to consult your doctor, because these are the earliest signs of heart failure, and heart failure, if treated early, like all other diseases, can be managed properly. So, what are the treatment options? First and foremost is prevention. Now, in prevention, we have to, if the patient is a diabetic, we have to control his diabetic, because diabetes weakens the heart. If the patient is hypertensive, we have to control his blood pressure, because this hypertension against the heart has to pump against the increased blood pressure and leading to failure of heart. So we have to control blood pressure. Next is salt and water restriction. About 1 to 2 grams of salt per day is the permissible limit in patients with heart failure, and fluid restriction depends on the amount of congestion. Generally, the doctor will prescribe you a fluid restriction of 800 to 1.5 liter per day. There are certain drugs like the diuretics. We have the furosemide, the torcemides, which increases the urine output and thereby relieves the symptom. There are other drugs like the beta blocker, angiotensin converting enzyme inhibitor, the angiotensin receptor blocker, the ARNIs, then there are spironolactone and eplerenone, the mineralocorticoid receptor antagonists. We also have the ivabradine, and so on and so forth. There are some other device therapies are also available, like the intracardiac defibrillator and cardiac resynchronization therapy. These are also available for advanced heart failure. And in severe heart failure in advanced stages, which we, as per the guideline, we call it stage D, in this patient, and there may be requirement of left ventricular assist device or cardiac transplantation. So, to summarize, heart failure is decreased pumping action of the heart. You can easily understand that you are having heart failure by assessing some of the symptoms like the shortness of breath, swelling of the feet, and decrease and fatigue. You can, if you have this symptom, you should consult your doctor immediately. Early treatment has wonderful result. So stay safe and stay healthy. Thank you.